Assalamualaikum dear students, welcome to your channel the Anatomy Canvas. In today's class I am going to teach you the axillary artery. So axillary artery, here in this area you can see that the axillary artery is a direct continuation of the subclavian artery. So what are its relation? This axillary artery starts just behind the first outer border of the first rib, and it is present up to the level of the lower border of the pectoralis major muscle. So from the outer border of the first rib to the lower border of the pectoralis major muscle, this whole will be area of the axillary artery. Now I will remove the pectoralis major muscle and also the deltoid. Here you can see in this area I will highlight the axillary artery again. So this is the axillary artery, which is a direct continuation of the subclavian artery. Starts at the outer border of the first rib and ends at the lower border of the pectoralis major muscle. This muscle is the pectoralis minor muscle, and this artery is passing behind this muscle. Here you can see over here that this is the artery and this hole is the pectoralis minor muscle, and this artery is running behind this pectoralis minor muscle, and this pectoralis minor muscle is dividing the artery into three parts. The first part, which is above the pectoralis minor, second which is behind, and third which is below the pectoralis minor muscle. Now I will remove the pectoralis minor muscle here. Here in this area you can again see this one is the axillary artery. So what are the other different relationship of this axillary artery are? I will add the brachial plexus to this area to show you the other relationship of the axillary artery. So here you can see this one is the medial cord of the brachial plexus, and this medial cord is lying medial to the axillary artery. Here you can see, just a minute. This one is the lateral cord of the brachial plexus, and this lateral cord is present behind the lateral to the second part of the axillary artery, and behind this is the posterior cord. So these are the different relation of the second part. In the first part, the artery with the different branches of the brachial plexus is enclosed in axillary sheath. Then from this area to this area, this is the second part, and below is the third part. So in the third part it has a different relationship. In upper part you can see the musculocutaneous nerve which is present, it is lateral to it, and in lower part you can see this is the axillary artery, and this one is the median nerve which is lateral to it. In the medial relationship you can see the ulnar nerve is present. This one is the ulnar nerve which is present in medial relationship to it, along with the medial cutaneous nerve of the arm. Just a minute. So this one is the ulnar nerve. In the center you can see this one is the medial cutaneous nerve of the arm, and this one is the medial cutaneous nerve of the forearm. So to the relationship of the lower third of the axillary artery, the medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and in between ulnar nerve, these three are in medial relationship to the artery, third part of the artery, and lateral relationship, the median nerve and musculocutaneous nerve are the lateral, while the radial nerve is posterior to it. So these were the different relationship of the axillary artery. Now I will show you its relationship to the just a minute. Now I will show you its relationship to the axillary vein. So here you can see this was the axillary artery, and this is the axillary vein. This axillary vein is lying in a medial relationship. This is the medial relationship up to the axillary artery, and this axillary vein is a direct continuation of the basilic vein. It receives the cephalic vein and it continues as the subclavian vein. So behind this is the axillary artery and its medial relationship is the axillary vein. Now I will remove the veins and to show you the different branches of the axillary artery which are present. So first of all, this one is the just a minute. So this is the first branch. So basically, as the pectoralis minor muscle is dividing the artery into the three parts, so this is the first part, the second part and third part. In this area, the pectoralis minor is present and is dividing the artery into the three parts. So very easy to memorize that from the first part there is only one branch, and this branch is the superior thoracic artery. Then the two branches are coming from the second part, and these two branches are first, this is the thoracoacromial artery, and this thoracoacromial artery then immediately gives branches. So these one are the acromial branches of the thoracoacromial artery, the deltoid branches of the thoracoacromial artery, the clavicular branch of the thoracoacromial artery, and the pectoral branches of the thoracoacromial artery. So these are the branches of the thoracoacromial artery which are one of the branch of the second part, and other artery which is the branch of the second part is the lateral thoracic artery. So just to memorize, from the first part there is only one artery which is the superior thoracic artery. From the second part, two arteries are given, thoracoacromial and lateral thoracic. Thoracoacromial immediately gives acromial branches, deltoid branches, clavicular branches and pectoral branches, and here is the lateral thoracic artery. Then moving on to the third part, the other branches, here you can see the another artery which is present. This is the subscapular artery. This is one of the largest branch of the third part of the axillary artery, and this subscapular artery gives off another branch which is the circumflex scapular artery. So this one is the circumflex scapular artery, and this area, this one is the subscapular artery. Then other branches of the third part are this one is the posterior circumflex humeral artery, and this one is the anterior circumflex humeral artery. So the three arteries from the third part, the first artery was the subscapular artery, the anterior and the posterior circumflex humeral artery, which are the branches of the third part. So just to repeat the branches, the superior thoracic artery, the thoracoacromial artery, the lateral thoracic artery, the subscapular artery, the posterior and the anterior thoracic artery. So these are the branches of the axillary artery. I will again highlight the axillary artery so you can see, and this axillary artery then continues downward as the brachial artery. So this one is the brachial artery and is a direct continuation of the subclavian artery. That's all about the today's class. Thank you very much for your attention, and Allah Hafiz.